there's lots of discussion going on right now about whether health care is a right. And I think that ultimately, in the future, Texans are going to consider that question to be as absurd as whether public schools ought to be separate but equal, or women ought to have the right to vote. You know, those of y'all that really know me know that I'm a cancer survivor. I'm supposed to be dead. But I'm here, I get to be in the Texas Senate because of early, effective, and frequent health care. That in my case, maybe most importantly, was affordable. I've got a 19-year-old son who at age 5 was diagnosed as a type 1 juvenile diabetic. That early, effective, frequent, and by the way, affordable health care provides him a life support system. Because the numerous insulin shots he takes a day aren't curing him of anything. It keeps him alive. But neither one of us ought to be privileged just because we have access to that health care. Neither one of us is special. Maybe me a little bit. No, neither one of us is special. Neither one of us is specially blessed. It is shocking to me that kids who have no control over their parents' circumstances don't have access to health care. Let's shift our discussion a minute. Let's get over the compassion part of it. Let's just talk business. Let's just talk economic development. And I think I speak with some credibility. I've been chair of the Greater Austin Chamber of Commerce, both as mayor and as chair of the Chamber of Commerce and even as senator. I have fought hard for economic development incentives to get businesses to locate in our community. But every time we did that, we were gambling a little bit. We were gambling those businesses would make. We were gambling they would create the number of jobs. Well, let me tell you about an economic development program where there's not much gambling to it. If you give me $1 for the Children's Health Insurance Program, I can get you $2.60 from the federal government. Roughly $2.60. I can guarantee you a return that's more than double. And by the way, when I say return, I don't mean just return on investment. I mean a return of your tax dollars. Because you've already paid the taxes that went to the federal government. And then if you take that dollar and you add it to that $2.60, and I can tell you how we can deal with it. We will put it into existing businesses in Texas. We call them healthcare clinics, hospitals, doctors, and nurses. And when we do that, what the economists tell us is that will spin through the economy. It has a dynamic effect that amounts to about a $7 return because we put up $1. But yet in the state of Texas, over the past 6 years, we have left on the table roughly just under $1 billion. Well, in my view, dealing with Children's Health Insurance Program that way makes good economic development sense. Back in 2003, an economist that many people know, Ray Perryman, was asked to look at the issue of what happens when $1 of state revenue is taken out of the Medicaid and CHIP plans. And he came up with, he says the state has a dynamic revenue loss of 45 cents. For every $1 taken out, we lose 45 cents. Local taxes rise. You may ask, how do they rise? Well, they rise because just because you didn't pay into that program didn't make a single kid well. They all still show up at Brackenridge Hospital or at the healthcare clinics. And how does that get paid for? Well, it gets paid for by local taxes going up. So he said the local taxes rise by 51 cents. Insurance premiums rise because the risk factors. Insurance premiums rise by $1.34. Business activity in Texas declines by $19.14 measured on a dynamic basis. Texas healthcare providers suffer direct uncompensated losses of 53 cents. Individuals in Texas pay out-of-pocket increases in taxes and insurance of $1.01 and see total losses of $3.38. That's for every $1. Businesses in Texas pay out-of-pocket increases in taxes and insurance. Induced losses of insurance coverage raise healthcare costs by 62 cents. And retail sales decline, which means we have less money in our state coffers, by $1.77 for every dollar. So, it's a compassionate program. that keeps kids healthy. It's a conservative program that ensures relatively small maladies don't become big illnesses. But it's a huge economic development program that I believe Texas leaders and our budget writers let it go by too quickly. And let me tell you, it ain't an excuse that, oh, we're going to be in rough economic times. In fact, it's precisely because we're going to be in rough waters that we should be smart. Let's get back as much of that federal money as we can. Let's get a guaranteed return on the state dollars that we're putting in it. Let's put it into existing businesses in Texas. Let's guarantee a return on that investment. Let's reduce property tax growth. Let's reduce insurance rate growth, and on with that program.